Welcome to the most authoritative show on TV. It's The Pulse. We are coming to you live from our studios in Kokomlimli on your digital terrestrial TV because we are free to air on DSTV channel 421 and GoTV channel 144. We are your home of independent, fearless and credible journalism. This afternoon, though, another attack on the police as police officers deployed for anti-robbery duties in the eastern region attacked by robbery gang allegedly wielding AK-47 assault rifles. We have details of plans by the police to curb the incessant robbery attacks. Also this afternoon, more vaccines for Ghana as Ministry of Health takes delivery of 249,600 doses of AstraZeneca from the COVAX facility to further support the ongoing vaccination campaign in the country. We have details on when these vaccines will be deployed for inoculations. Plus, on The Pulse this afternoon, we explore why many media and security personnel may be suffering from emotional constipation. We have details of a study that reveals many personnel from these two entities suffer poor mental health state due to the nature of their work and the poor conditions of service. You want to stay for that conversation? My name is Ibrahim. The Pulse is brought to you by Global Dignilu Affordable Safe Sanitation. Remember, we are also streaming live on YouTube and all our social media handles. Tweet at us with the hashtag The Pulse. My personal handle is @the_Nana Aisha. Always a pleasure to host you. Some police officers deployed for anti-robbery duties in the eastern region were on Tuesday dawn attacked by a robbery gang. The robbers allegedly wielding AK-47 assault rifles were on a Chim-Etukrum Bonsu stretch to rob commuters when the police vehicle on board with police officers bumped into them. The robbers, according to a police source, upon seeing the police vehicle, opened fire through the windscreen. The police officers, who were taken by surprise, took cover and returned fire as the driver confidently drove to safety. Kofi Siao is our man in the eastern region. He joins us via Zoom with more on this incident. Kofi, what more can you tell us about this incident? Kofi, kindly unmute for me.
Okay, so when the police were returning from their patrol duties and in Osiem, and on reaching to Chrome, they saw this gang of armed men trying to stop some vehicles on that stretch. So when it happens like that, the police had to, take control of the situation. And the robbers, on seeing the police officers, started firing at them. And the police also took cover and later returned fire. So it was an exchange of fire between the police officers and the armed men who were robbing on that bridge.
Kofi, how is the police service responding to this? Have you been able to speak with them?
I was talking to the deputy superintendent of police, that is the PRO for the eastern region, Mr. Ibrahim, and he tells me that they have launched investigations into the matter, and they believe that they're going to arrest the perpetrators of that incident and ensure that they are prosecuted right.
Let's now, so the police, are they safe, the police officers that were involved in this? Hello, Kofi Siao.
Hello. Yeah, I can hear you.
I'm asking if the police officers are safe, the ones who were involved in this incident.
Nobody was, all the officers who were on board, that has also, none of them has reported of any injury.
All right, it looks like we're having some connection problems with Kofi Siao's internet. we would cross over to the Information Ministry, where we are getting updates on the country's COVID situation and also some health projects government is embarking on for the country.
So I mean, trying to address our level of care. Population is increasing. So in addition to Greater Accra Regional Hospital, that is a RAGE, we're also developing a sub-regional hospital in Tema to be able to take care of, I mean, people within that environment. So Tema, as I speak now, the project was actually handed over to the contractor this morning. So Tema has been handed over. The Central Medical Stores, which was ravaged with fire, has also been handed over to the contractor for a complete reconstruction to a high class and what we call a pharma-grade facility to be able to manage our medical supplies and the rest. In addition to that, we are setting up. We are setting up a district hospital in Kranza. They are all one package, and also doing an A&E, Accident and Emergency Center in Doma. We are also going to construct 12 hospitals in Eastern Region, Ashanti, Ahafo, and Greater Accra, and the size are the following. Eastern Region, we have Jumapo, Kwabin, Nkwetia, Edukrom, and Achiase. That is the Eastern Region. And in Ashanti Region, we have Swami, Drobonso, Sabronumu, Manson Kwanta, Chedie, Ahafo, we have Mem, and Greater Accra, we have Pong Katamanso. These projects will certainly see the light of day. And I believe that with about the next week or two, the contractor is mobilizing to site. It's being done by Vamed Engineering of Austria. So in a nutshell, these are the projects that are actually ongoing in the Ministry of Health, and I'm happy to make this presentation on behalf of my honorable minister. Thank you very much for listening.
On the country's COVID situation, you may be aware that we've taken delivery of some vaccines from the COVAX facility. We've been getting those updates, and also we'll be getting some updates on projects that government is embarking on, health projects to help deal with the COVID situation and other health matters. We'll also be getting details of when these vaccines will be deployed, all of that. Let's go back to the Information Ministry. And we have the health advisor to government, Dr. Nsiansari. He's on now.
Here on the 25th or so of April, one of the updates in COVID situation in the country, the popular fellow Ghanaians, His Excellency the President announced what his government wants to do to improve the health systems in this country. Before then, the President charged Ghana Health Service to come out and tell us where we have hospitals, the district hospitals, and districts that we don't have hospitals. When Ghana Health Service went around, they saw that there are about 88 of the 260 districts in this country without anything of semblance of a hospital. What it means is that such places, with a population of over 100,000, some of them 140,000, and in one of the districts, for example, Chumako, over 250,000, there was no doctor. That's what it means. If there is no hospital, doctors will not be there. And as Mr. Nkansa and the minister said, our health system is in a tier system. We have the community health planning system, which is the lowest. Then we have the sub-district system, which is catered by the health center, where normally we have physician assistants. And then we have the district hospital. The district hospital is the first referral center, the primary referral center. So if you look at it in this way, you have the base, the community health systems, and then the health centers. They are supposed to be feed into a district hospital in a district. And then the district hospital will then feed into the secondary health care system, which is we call it the regional hospital. That's where we have specialists, at least the 4 basic specialties: medicine, surgery, obstetrics and gynecology, and sometimes ophthalmology and also dental services. And then we have the teaching hospitals and the specialized hospitals. So as a country, if you want to achieve universal health coverage, which you are all just fighting to achieve universal health coverage, you should have a system where people can attend hospital near the place that they are living without any financial encumbrance. Luckily for us, since 2003, we have the National Health Insurance Scheme, which this government, as part of the manifesto for 2016, and then also 2020 elections, we want to put the health insurance on its feet, and we are doing that one assiduously. So if you add the health insurance plus easy accessibility to healthcare systems, then you have what you call universal health coverage, which is for SDG 3. And that's exactly what the president and the government wanted to do. So when they came out, that we have 88 hospitals without, 88 districts without a hospital, out of the 260, then the president said, we have to have these hospitals in place. And I will explain why some people are saying, why don't you finish the other hospitals before you start doing hospitals in the other places? If you are in one of the districts, I'm sure you will be annoyed. You will not say that. And secondly, Ms. Ankansa has gone through to tell us that every hospital project that you have has a source of funding. If it's Eurojet funding, if it is VAMED funding, if it's NMSI funding, you don't go and use Eurojet funds to go and do NMSI funding, because they are external funding. And this, what we are going to do, government is going to fund it. And I'm sure somebody will ask, where are you going to get the money from? But where there's a will, then there's a way. So if you don't have the will, you won't have the way. But if you have a government which has a will, which has a vision, and the vision, I believe that when you're having a vision, you don't have small visions. Small visions are no vision. And it's in the good book, the Bible, that if you don't have vision, it means you are lost. So this government has vision. And if you look at it, the government has a vision towards human capital development. One, digitization to make sure that we have smart economy in this country. The second one is to have educated people in this country, the free SHS. And to me, the third one, which I'm very happy about, is to have healthy people who will do all the work in the country to create wealth. So these are the three cardinal points that I see that the government is trying to do to improve the status of the economy of this country. So when we look at it, we realize that there are some districts. If you put a district hospital in one place, if you are going to build the 88, they still have a problem, because if you look, I'll take a district like Achuma-Kwangma. Achuma-Kwangma is like a U covering the whole of the former Kumasi Metropolitan Assembly. So if you put a hospital which is being put by VAMED at Kedie, which is the western part of Achuma-Kwangma, and then you leave the Kwangma side, which is the eastern part of Achuma-Kwangma, which has a population growth of over 200,000. The place is growing. Then nobody can pass through the Kwangma side, go through Kumasi, and go to Kedie. So we look at all these things, and then it was decided that let's add some hospitals to some places so that everybody will have access to good, healthy, and quality health systems. And that's the reason why we reached 101. So the Agenda 111 consists of 101 district hospitals, state-of-the-art, fully furnished, fit-for-purpose hospitals. And I'm using the fit-for-purpose advisedly, because people will ask, why are they not the same hospitals around the country? There are some areas where the population is different from other areas, and we are going strictly according to the WHO guidelines of number of beds per population at least. That's what we used. So we had 101 district hospitals, which are going to be built with all the facilities: medicine, medical ward, surgical ward, pediatric ward, maternity ward, labor ward, 4 theaters, administration block, X-ray, physiotherapy, kitchen, maintenance unit, and then a place where we'll do the electrical systems. And it is being done in such a way that we take the environment into place. There will be water harvesting, there will be solar energy, so that the place will be like a green hospital. And then, in addition, we are also going to have regional hospitals which will serve as the secondary referral centers for the new 6 regions which don't have any hospitals as a regional hospital. Luckily, we have the Ashanti regions having a regional hospital, and the other regions all have regional hospitals. And then the president said we should also add a new regional hospital for Western region, because you look at how Western region is growing, and the Fio Quanta should be refurbished into a metropolitan hospital for the Sekondi Takoradi metropolis. So if you add that one to it, then you have 108. And the president then asks, what about mental health services? So this is somebody who is looking at health holistically. So he said that if you look at the mental health services, even though we have mental health beds in psychiatric beds in almost all the hospitals, if you have a specialized psychiatric issue in this country, if you are at Bunkurugu Yoyo, you have to move to Accra or Ankafu, other Pantai or Accra Psychiatric Hospital. So His Excellency the President then decided that put one psychiatric hospital, specialized psychiatric hospital, in the middle belt in Kumasi, and then put another one also in the south, in the northern belt, in northern region in Tamale, so that even students, nursing students and medical students who are doing studies in psychiatry will not have to move every time to Ankafu or to Pantan. So if you add that one, then it makes it 111 health facilities. So that's what the meaning of Agenda 111. Agenda 111 is moving Ghana from where we are towards universal health coverage.
So Doc, let me interrupt you. Like I mentioned earlier, from yesterday, we've received over 20-something questions that we'd like to quickly run through for you to help us with some answers. And then colleagues here, if you have follow-up questions, you can ask them. Mr. Obieje, you have the microphone. So quickly take us through some of the questions. We'll take them, then Doc will respond. We'll take them. So let's take them in batches of about 3. And then Doc will...
So that was the Presidential Advisor on Health, Dr. Nsia Asare, who's been speaking about projects being embarked on by government. He's been talking about the Agenda 111, which was inaugurated a few days ago by the President himself, who admits that the COVID pandemic, for instance, has exposed the negatives in our health sector. And he's been trying to provide answers to some questions which the Information Minister says has been coming up since the Agenda 111 project was launched. And so we'll be going back there to listen more on what they have for us. But still on health, the Ministry of Health has this morning taken delivery of 249,600 doses of AstraZeneca vaccines from the COVAX facility to further support the ongoing vaccination campaign in the country. Details on when these vaccines will be deployed are yet to be communicated, but we know that the Greater Accra and Ashanti regions are currently inoculating the public with Johnson & Johnson vaccines. The 5 days rollout plan in the Ashanti region comes to an end today, but officials intend to extend it for a few more days following the vaccination of 30,000 people so far. Here's Dr. Roxanne Michael Ajay, Deputy Director in charge of Public Health in the Ashanti region, giving reasons why the exercise is likely to be extended.
So far, it's been very good. Patronage is very high. And if we catalog from the weekend when we started, and the weekend it was a bit jerky for obvious reasons, because weekends people usually will not have time to come out for such exercise. But from the Monday, it's been very, very active. On average, we've been doing about 8,000 to 9,000 doses daily. That's 8,000 to 9,000 people are vaccinated every day. So as it stands now, we've done over 30,000. And though today's official date for completion of the vaccination exercise is likely to be extended to Friday, as long as we have vaccines. We have about 20,000 doses left, and I'm sure by the close of today, we'll be left about 10,000, looking at the rates of consumption within our region here.
Yes, this saying that last days are dangerous. Are we seeing this last day, rush in the COVID vaccination exercise?
There's not been any rush. The loads of people you see here, it's what pertained for Monday. As I said earlier on, the weekends was very calm. The weekend was very calm. But for Monday, it's been a bit turbulent in terms of numbers turning up. And since we left with some doses, and the message is also out there that we are going to run out of vaccine, we expect such clamor or such huge turnovers in our various centers. Quite so called that they run out of vaccines, and that is all that they have. And they still have some people yet to be vaccinated. So we are trying to mobilize from other areas to be able to satisfy those who have come to queue since morning. So for them, it's likely to close today, because when the 300 people are done, they won't have any more vaccines. The other areas also have equally high number of people turning up to get vaccinated. So that is what we are doing. But we are limited by the number of doses we have, and that is about 50,400, what we receive from national.
It's been 5 days when you started this exercise. Is it not surprising that the 50,400 doses that the region received, we still have some backlog to be covered? That we still don't have people in the queues, so much that they will be ready to be vaccinated.
We have more people than vaccines now. Like I said, it's been 5 days. But the first 2 days, entered the weekend. People usually will not come out because of funeral, Ashanti region, funeral and other festivities will not make people take off their weekends for such exercise. But from the Monday, it's been very, very turbulent. People are all over, and from all the centers, they are always having people queuing up for the vaccine, which is why I'm saying that we're going to extend it a bit so far as we have vaccines. And we are not likely to extend beyond Friday, looking at the rate of consumption that we are doing on the average about 9,000 doses daily. I mean, if you take away what's happening over the weekends, which is extremely very low. From the weekdays, Monday up to yesterday, we knew an average of 9,000, and we have only 20,000 doses left. So if the rate should continue, it means that today, tomorrow, we'll be done with all the doses that we have received.
Let's look at the reaction of this Johnson & Johnson vaccine. Is it the same as the AstraZeneca, vaccine, or probably what has been the response from those who have participated in this exercise as far as the reactions are concerned?
So far, our surveillance system has received reports of only 3 adverse events. And that's not to say that is all, because the surveillance system we use is a bit passive, that it depends on you reporting either to the health care provider or going on the net or using the MedSafe app. And usually, the sensitization was high that people may experience some fever, headache from the vaccination, actually proving that your immune response or your immune system is actually being stimulated by the vaccine.
The mad rush for the Johnson & Johnson vaccines in the Ashanti region as the exercise winds up. Ohimenseri of our health desk reports residents of Kumasi Metro, Asokwa, Oforikrom and Kwadaso municipalities have had to endure several hours of waiting to get their jabs.
There's so much people, queued up here to be served for the vaccination exercise. There's a long winding queue as far as from the entrance of this particular building right to where we are now, and a lot more people are waiting to be served. Let me find out from Dr. Omari Sasu, the Metro Director for Health. How are you able to manage this whole long winding queue here?
Thank you very much. We have a number of teams working, doing the data entries, and this helps to make the line move faster. We have reassured everybody that those available here will get vaccines for today. So we are counseling them and giving them the education. It's likely we'll run out of the vaccines today. So today is the last day, mostly for Kumasi Metro, with the COVID-19 Johnson vaccine for today. We are very happy with the turnout, with the media and the education that has gone on from the NCC. They've helped us a lot with educating the community about the COVID-19 vaccine. COVID-19 is real, and we should all continue to observe the protocols. Thank you.
How do you ensure that all these people who have gathered here, you don't mess up at the center? Yes, the numbers are huge. So how would you know that these are the people who came first and have to be served first? How do you manage the situation?
Okay, so we have a queue for the elderly. There are some who are the elderly. We make sure we have priority for the elderly. So we see them, the middle age and the younger ones can wait in the queue, and we follow the queue duly. So they make sure there's a team making sure that they follow the queue as it's at hand. If you are elderly, we give you a priority. We have a team who are managing the elderly who are coming to us.
other centers, we learned people who have taken part in the the AstraZeneca exercise, also turn up to be served. Is that the situation here?
A few came, we've cancelled them. So as you come, we give you those who are eligible. So if you are waiting for your second dose, this is not the time. We are reassured that very soon the second dose will also come on. So we've reassured them that they should wait. When the second dose for the AstraZeneca is in, we'll let them have it and inform them for them to come. So they've understood it. So those who are here are those who haven't taken any of the COVID-19 vaccine. We also do a case research in our app to make sure you have not taken the AstraZeneca before we make sure we give you the Johnson & Johnson vaccine. Thank you.
Oba na 7 more. Na wo hwe ba bia wudi a wo ani da so say beduru so ansa na wako.
Ya hwe ya me. Ya hwe ya me. Ya twa ya wa twem. Ntisom ka se o mapu a yeni asam ka. Ya batwa da fofo na yaba.
So this is somebody who has been here since 6:30 a.m. And he says he's been waiting. Once he's here and he's been assured that he'll be served, then he's encouraged to still wait. If you look at beyond this queue, beyond the walls of the clinic, there are people who have also queued up, and they are just almost on the roadside. So it's an indication that the numbers are very, very huge here at the KMA clinic.
My colleague Ohim Interior, who's been following this for us, has latest from some of the centers, and he's there. Are there still long queues, Ohim?
Yes, Aisha, the situation is almost the same as I reported from the vaccination centers. Nothing has changed. Many people are now trooping to the vaccination centers to be vaccinated. It's a situation health authorities believe is one of the measures that they put in place to send information to the public that is working, and that's how come you now have huge numbers at the facilities. What it means is that each of the centers in all the, let's say that the 36 centers in the region, we are looking at 9,000 people being vaccinated on a daily basis. So in all, the region has seen not less over 30,000 people being vaccinated, with the hope that by the close of today, we still may have 10,000 people to be vaccinated, because from the account of the Regional Health Directory, they have about 20,000 doses of the Johnson & Johnson vaccine available for residents in 4 hotspot districts in the Ashanti region.
Ohim Interior is a member of our health desk. Let's get on with the latest as far as the COVID-19 cases in the country are concerned. 51 people are in critical condition, with 128 severe cases. And of course, 524 active cases. Now, new cases, active cases now 6,265. Confirmed cases, 112,378, discharge 105,168, and that's now at 945. Head of our health desk joins me via phone, Fred Smith. How are our cases looking?
Well, Aisha, from that information from the dashboard, as you showed us a while ago, we're seeing 15 deaths in one day, and that's very worrying. We're also seeing the cases, the number of new cases also going up, still around 524. Also not encouraging at all. We have more of these persons in critical or severe situations, and they are also occupying our health facilities, and that's why health officials say our facilities are stretched. So in terms of our case situation, that's what is happening on the ground now.
You have picked up information on how these additional vaccines that have been delivered will be distributed. What do you know?
Well, I can confirm that this morning we received nearly 250,000 doses of AstraZeneca, but this is the Oxford AstraZeneca manufactured in the United Kingdom. If you recall, when we did the first round of vaccinations with the AstraZeneca, there are lots of people who did not get their second jab. and who have been waiting to get this, and that number is around 250,000. And so there's the belief that this will be able to deal with the backlog that we have. And these vaccines make up what the UK government is donating to 4 countries or countries that cannot immediately access the vaccines through the COVAX platform. Nigeria, Egypt, Kenya, and the other countries that make up these 11 countries have also started receiving theirs. Nigeria got theirs on Monday, Kenya got yesterday. And so the Director of Public Health at the Ghana Health Service, Dr. Franklin Esedubekwe, has been speaking to this, even though he cannot say exactly when the vaccines will be deployed. He believes that because the health workers have already been educated on how to administer the vaccines, it's likely that from next week, maybe on Monday, we will be able to roll this out so that almost everybody will. And don't forget that we've been assured that right after the difficult period in India, the hold up in the supply of vaccines, we will be receiving lots of these. This is the UK's donation to the COVAX system. Now, we have heard about the United States, and that's what we are currently working on, the Johnson & Johnson vaccine. We are expecting Moderna and other brands of the vaccines. And so the reason why we've enhanced our cold chain system to be able to hold some of these vaccines and serve those who need them. 20 million, the president says, we need to vaccinate out of the 31 million Ghanaians so that we achieve herd immunity, Aisha.
Fred Smith is head of our health desk here at JoyNews. Let's now listen to Director of Public Health at the Ghana Health Service, Dr. Franklin Esedubekwe.
We took delivery of 249,600 doses of AstraZeneca.
Now, are these part of the COVAX facility or the AU arrangement?
No, this is a different arrangement. It's not part of the AU. The AU is actually looking at more of Johnson & Johnson. So this is a different arrangement.
Which arrangement is this, if I may ask?
This is from the UK government supporting the COVAX facility.
Right. So is this a donation or do we have to pay for them?
I don't think we are going to pay for this one. I think that most of the Johnson & Johnson ones are the ones that we are paying for through the EU and maybe the Sputnik. A number of the COVAX facilities vaccines are not to be paid for.
We're still live on the Pulse. Hashtag for tweets is that Pulse. My personal handle is at Danana Aisha. When I return from this break, we'll be having a conversation, and it will interest you to know that media personnel and security personnel in this country, many of them are suffering from what a research calls emotional constipation. You want to stay on for that conversation. Welcome back to The Pulse. Let's have a conversation about how mentally stable workers are in this country. This afternoon, we are focusing on media personalities and security personalities because the Ghana Psychological Association has revealed in its latest findings that many media practitioners and personnel in the security services in the country are suffering from poor mental health state due to the nature of their work and poor conditions of service. According to the association, studies conducted into the psychological well-being of personnel in the media and security services by some of its members in 2019 and 2020 revealed that personnel in the two sectors experienced what it termed as emotional constipation, as they could not express their grievances due to their job description. Let's get more on this one. And Dr. Colin Sajaman-Bedu, he is the president of the Ghana Psychological Association. He joins me in studio for more. Emotional constipation, God, yeah. I got scared when I saw that. What does that mean?
Well, Aisha, when you get constipation, as we do know, you know how the feeling is like. It's not something comfortable. And by emotional constipation, all that we mean is that people are not free to express themselves. And so you wish to say certain things. You wish to address some concerns you have. But unfortunately, you are not able to do so due to few factors surrounding your work. It is similar to what we call emotional labor, where you try to suppress your emotions, all for the sake of the work that you do.
Okay.
So by emotional constipation or labor, the extent to which media persons suppress their emotions, or in some cases, they also enhance their emotions in order to match up, step up their game as practitioners within the media industry.
Okay. Now, let's first look at the objective of this study, because this is an area which I think a lot of people have not paid attention to.
Yes.
What was the objective first for this study?
Basically, if you look at psychological studies, psychology in general is a field of study and also a field of practice. So what it means is that it's a discipline where people can study to orient themselves, develop understanding about human behavior and why people do the things they do. We also practice it to provide intervention to help the general populace. It doesn't matter where they find themselves, at the workplace, in schools, within the community, and what have you. So the primary goal for this research, between 2010 up to today, we saw a sharp rise in terms of the number of radio stations, the number of television stations we have in Ghana. And that was good. It was an addition to our democracy. It also showed the extent to which people were craving for more knowledge, more ideas, more discussions. But if we had over 200 television stations as at 2017 thereabout, we had over 400 radio stations, it has implications for human resource. It means more people are being employed into the media industry. Now, from a psychological perspective, we realize that not much had been done when it comes to understanding the work structure, the work patterns, the challenges, the psychological health states of media practitioners. And this is what moved the researchers to move into trying to understand what is going on when it comes to the work of media practitioners. If there are any challenges, we want to know, and what is the way out.
Let's look at the methodology, the parameters. What are the criteria, you set for this research?
So if you look at the research that we carried out, we targeted media practitioners, journalists in Accra, Kumasi, and Western region, what we normally call the research triangle of Ghana. And we also looked at how many radio stations, TV stations are within these jurisdictions. And you could actually tell we have a lot of radio stations within these three areas. So we sampled permanent employees, so to speak. So if it has to do with journalists, we wanted permanent ones. We did not include those who were doing their national service, those who were doing attachment. No, exactly. So in terms of inclusion criteria, once you've worked in the media industry for 1 year or more, then you get included. But we're especially interested in the lived experiences, those who have worked for long. So we had two wings of the research. One was a survey where we engaged 336 media practitioners. And then the other one was a qualitative research where we engage people on a one-on-one interview to understand over the years their experience as media practitioners. What are some of the things that they have gone through? For that particular one, we're interested in what they themselves have experienced. And we gave consideration to those who have worked 5 years or more. So all those who have worked for many years, they were involved, and we engaged about 13 of such ones within these three areas.
And I'll come to the security parts. Now, let's look at the findings itself. I want you to take me through one after the other. Let's understand why someone like me can get emotional constipation.
All right. So if you look at the findings that we had, I will put it simple. We found two key areas of psychological state. The first part was what we call the psychological states. And then the second aspect is the behavioral response.
Okay.
If you look at the psychological state, it explains their psychology, how they get affected. Now, we found some media practitioners to exhibit depressive symptoms.
Okay.
And then some were overly stressed. Others had what we call emotional dissonance. They wish to be themselves, but they can't be because of the work that they have taken upon themselves.
Okay.
And then suicidal ideations. It was shocking
Okay.
to know that some journalists, some media practitioners felt suicidal. And why was this so? The way they are sometimes treated by the public.
Okay.
You get you just go off your line. You get involved in a small mistake. You mispronounce a word.
Okay.
And the public will just lash you, bash you, threaten you with insult and what have you.
Okay.
It could also be a story that you have done. It did not go well with one party or the other groups of people or what have you. And the way they will threaten you. Some people actually felt suicidal at a point in their lives because of how they felt. Then there were nightmares and even insomnia, sleeping problems.
Okay.
These were especially the group of people who are on the field. They go there, we say first in news. You media practitioners, you are the first to see and break the news.
Okay.
First in news means you are the first to witness horrible scenes.
Okay.
And you are humans as well. You see dead bodies when it is an accident, someone is being raped, you see the incident and what have you. All these pictures are being what? Captured in your memory. And over time, vivid flashes of the memories, you are not able to sleep for days and what have you. And many of such field work journalists were going through this. Then work-life balance was another challenge, especially when it gets to some peaks of moments of some works that you'll be doing. Election moments, event-filled moments, some will cover back to back without having rest, and it affected their work-life balance. Then turnover intentions. Most media persons will continue to develop themselves because they feel, if you look at the growth structure in the media industry, it's not clear.
Okay.
You don't know from where do you move to. What is the structure of growth in terms of the developmental part within the organization? That is also not clear.
Yeah.
So some were likely to also turn over. And the last bit that we found under the psychological health state has to do with superior subordinate bullying.
Okay.
And that one, we saw it clearly from the observation part of the research. We visited the studios, the cockpits, we sat down, we observed, and you could see how the anchor, especially if the person is an experienced one, well-known, a good brand for the organization, shout and scream at others who are supposed to do what and they are not doing it. Sometimes producers will speak into your ears and shout at you, cut the person, and they keep shouting, and you are still looking into the camera. If
My
you don't
producers
take care,
are laughing
I know,
because they are
you get it. So you see, superior subordinate bullying continue to even happen.
Okay.
And these are the psychological states. In terms of the other one, the behavioral response, some will vent all that they are going through. Some were just engaging in what we call ventilation.
Okay.
Some will weep and weep and weep in the quietness of their homes. Some will stand in front of their mirrors and weep. Some will go to the washroom and weep. Some of the experiences that they go through, they cannot share it with anyone.
Okay.
And then we also found few engaging in wrong coping mechanisms, taking in alcohol, smoking, and then intemperance in social activities. Meaning they try to be busy hanging out with boys. Thank God it's Friday. And then Yebudidi and what have you.
Really?
So these are some of the psychological aspects of the research that we found.
Okay, so there are key points I picked in all that you've been saying to me. Some I can relate to. If you talk about overly stressed, yes, I can relate to that. Nightmares, sleeping problems. I have my own colleagues who, for instance, witness some events that is making them unable to sleep, even without light, because of the horror and pictures they've seen. So I can relate to that one. If you say depressed, why on earth are they depressed?
It's a number of factors. You know, there is a rationale for anyone trying to be a journalist. So when the very reason why you want to be a journalist is being threatened, it affects your sense of satisfaction.
Okay.
You know, we are motivated from two angles. Either intrinsically, you have the passion that I want to be a journalist. Or there are some because I want to be popular. I want to be seen by everyone on screen, so I want to be a journalist. Which is your motivation? There are some who are highly motivated inwardly to be journalists. So imagine the situation whereby there is an order from someone, get this person off as an anchor. What has the person done?
Okay.
Perhaps in your attempt, in your quest to do your work well, it can make you feel depressed.
Okay.
Because you feel the dissonance. You are doing your best, but it is not being appreciated. It is not liked by the other side.
Yeah.
That is a cause for depression. Some also share the experiences whereby I was engaged as an anchor. When you are no longer needed, you are pushed maybe to stores, you are pushed to reception. It is a psychological way of telling you we don't need you.
Okay.
If you go back home and reflect, if you don't take care, you will definitely get depressed.
Okay.
So it is about the life-changing situations around your work. It can push you to feel depressed.
Okay. So now, you made recommendations?
Certainly.
Definitely, because the fact about stress, fatigue, sleeping problems, and nightmare will continue to happen. The bit about superior subordinate bullying, I'll talk about that. But what are the recommendations you gave in that study to deal with some of these things?
It's very simple. One of the things we found is that many of the media stations do not even freely allow employees to have their own voices.
Okay.
By this, I mean the establishment of unions to actually champion the welfare of the employees. Many organizations, especially within the media industry, are not good at that. And that is the first step. So for instance, multimedia, if you do have a union, it should be strong. If you don't have, this is a wake-up call. Because unions challenge management. It is also a check and a balance to support management to reorient themselves. It is a wake-up call for management to step their game. So that is one of the foremost recommendations that we made. Second, we need to look at the HR structure in media organizations. We realize that we have some kind of ad hoc HR structures within all the media industry. If you have a proper, well-coordinated HR department directorate, then the lines of progression are clear, the welfare issues are clear, the ethical issues are clear, and it becomes very easy for the HR practitioner to request for psychosocial support. And that was one of the key recommendations. At least every 3 months, those especially who are the forefront of reporting, going to the field and what have you, you need to go through psychosocial support from a psychologist. By that way, you'll be able to reorient yourself, adjust appropriately. If you have any challenges as a result of your job description, you'll be able to adequately deal with them.
Let's look at the bit about the superior subordinate bullying. I mean, from the explanation you gave, I don't see it as bullying. I see it as getting the job done, because that's how we are oriented. That, listen, you can't go about telling your viewers that I did my best, but I didn't get what I was looking for, because you have a date with your guest. At that time, when your guest is seated and waiting for you, you need to give results. So if you have to somersault, you have to swim or dive and do whatever to get the thing done, you have to do it. So how do we balance this? Because definitely when you are getting, if I am a producer and a reporter is frustrating me, I'll definitely, you know, vent my anger. I would let them know that I'm frustrated by your actions. So how do we balance it so we don't give people this emotional trauma you talk about?
So even from your question, I can see the psychological challenges in there. You mentioned about venting your anger. You mentioned frustration. And those are all psychological issues.
Definitely.
So what it means is that we may have to train your editor, your producer on emotional intelligence. And how to regulate her emotions, his emotions. You would also need to be trained on how to regulate your emotions so you don't vent. Remember, the premise of psychology is that individuals differ. someone, you scream at the person, and the person may be okay.
Get disoriented.
Yes, and that is basically what emotional labor or the constipation is about.
It's about.
Because you are screamed at. If it was in a trotro, someone scream at you, what would you do?
Mm-hmm.
But because of the job description, you can't scream back.
You can't scream
so
back.
you suppress your emotion in order to do as expected of you.
Okay.
And that is the emotional labor or the emotional constipation. Okay. There is a balance. But the bullying comes when a boss is called by a relevant other that this person, we don't need him. Okay. We don't need her. Okay. You can't air this story.
Okay.
That becomes a strong element of what?
Definitely.
Bullying. And then the boss impresses upon you not to do what inwardly you have worked so hard that you wish you will air.
Okay.
The other bit has to do with whereby you are engaged to do a particular job description, particular role. And because there are few challenges, you automatically moved from your position of responsibility to another area. Okay. Then you feel you have been bullied. There is no engagement, no discussion before you do that. So it depends. We are not saying let's water down the job that you are supposed to do. No.
Okay.
Every organization, every occupation has its own do's and don'ts.
Yeah.
There are pluses if you want to get it done well. But the point is, we need to also give attention to traces of what? Psychological lapses.
So there must be a balance at all times. But how about the individuals? How do you handle it? Because like you said, there are individual differences. There are people who can handle it when their superiors scream at them. There are those who cannot. And because they are their superiors, they cannot, talk back. So how do you handle the situation as an individual?
Once again, that is where the role of the HR comes in. Periodically, we need to do an assessment. When we talk of performance evaluation or appraisal, it is not what is being done in some public sectors. Okay. At the end of the year, the manager look into the skies and say, oh, that one he did very well. And then you get notified. Performance evaluation, behavioral patterns at the workplace should be done every day. So day in, day out, as people are working, you take note of their pluses and their minuses. It is an opportunity to give effective feedback. When you realize this particular employee, the person needs to improve in this area. Okay. That is why you are there as an HR. Okay, if there is opportunity for training, let's help this person there. If it is a one-off situation, one individual needing help in a particular area, what do? There could be one-on-one coaching. I remember I have done one-on-one coaching for some big journalists because they had challenges with kowtowing to authority, following directions, and they needed help to be able to get realigned. So it is at this point that the organization could even recommend, once again, the services of a coach, the services of a psychologist to help these ones to realign them so they can continue to support the organization.
A good one there. I'm picking some tips from what you're saying, but the bit that baffles me is the fact that you're putting media personnel and police officers in the same boat. We do different things. Even though we are all both watchdogs, but our jobs are different. How is it that they're also facing the same challenges that we face?
Well, it's interesting because if you look at what we found in terms of emotional labor, the police industry is a rank organization. You salute when the superior speaks.
Definitely.
So you dare not challenge. It's similar to what we are talking about here.
Oh,
You see the resemblance.
Mean, in the media, I mean, I don't see the media space to be saluting all the time. I mean, compared to the security.
Compared to, yes.
Over here, we talked, even our CEO, you can tell him that this one, you're not right on this one. Right. So I don't see that to be similar.
But there are resemblance in terms of how far you can express yourself. Okay. And that was linked to the fact that some media stations, you don't even have union. If you don't take care and you overstep your boundaries, you'll be shown the door. Okay. Now, the other bit that was closely aligned to the police was the work you do. If there is an accident scene, the media is there to report firsthand. The police are usually there to also report. So in terms of the insomnia, nightmares, images that they will be having, there were similarities. Then when it comes to the HR structure, you could see that, like the media industry, there is an improvement that is seriously required within the security industry.
Okay.
Most security industries, in terms of spreading out so that we're able to account for the well-being and welfare of each officer, there are some lapses that needs improvement.
Okay.
And as far as psychological support is concerned, I will commend the military. They took the lead in engaging the services of psychologists, and they've done well. They continue to improve. And I think the police have also started emulating the fine example of the military, which is very commendable. So the past IGP, the current IGP, they are all committed to supporting the police psychologically. And I think the biggest room none of us can fill in terms of organizations is the room for improvement.
Okay, but of course, the bit about the security is what's making me think, could this explain why we're seeing many police officers commit suicide in recent times?
Well, there are a number of factors that make people perhaps think that life is not worth living.
Okay.
And it is a multifaceted situation. It could be one of them, the fact that they need improvement in their welfare system, they need to improve their psychological health, their conditions of service, and then, like I said, they need a lot of support when it comes to their HR management of the personnel. Because if you think of having close to 40,000 personnel, as we are told, then it will require that we have a lot of personnel who are duly qualified to manage the police service. In my view, we need to decentralize the management of the HR units of the police service. It will not be wrong to have regional officers in charge of HR and even trickle it down to divisional levels so that there will be lower coordination, easy access to help, support, and by so doing, I'm sure. And aside that, you know, their work is very demanding, very, very demanding. If you look at work-life balance, that is one of the challenges that many police officers have. You can be transferred within 2 days and you have to move.
Okay.
So we need to factor in how these officers will also balance their lives, that of their families, that of their children. Granted, it's a security asset to quickly move people here and there, but we need to also be circumspect in terms of how these people reconstitute themselves, that of their family, and then adjust to a new assignment that they may be given.
I'm grateful this afternoon. It's been a wonderful time with you, because these are some of the things that nobody talks about but really needs to be talked about. Dr. Collins Ajamambedu, he's president of the Ghana Psychological Association. Truly grateful for your time. And the National Development Planning Commission has launched a policy framework dubbed An Agenda for Jobs. The midterm evaluation, which was supported by UNICEF, looked at 6 areas in Ghana, namely child protection, education, health, nutrition, job creation, water and sanitation. The Director General of the NDPC, Dr. Mensah Brampa, admonished all stakeholders, especially MMDAs, to ensure they work within the policy to achieve sustainable goals.
We at the district must look at the other side of the responsibility. How do we, first of all, provide for them the market, the market setting, so that they can even sell, creating for them what we call the collection and bulking points, so that these can be bought and sent to the processing centers. These are things where the district significantly should take up as their responsibility. Again, one of the critical areas which came up was access to land for these private investors. Okay. And if the private investors have ready access to land, ready access to water, electricity, which are all responsibility of the respective district, to see to it that these facilities are available, then it will help them. So it's obvious that we should be able to work out, and it's our responsibility together, Ministry of Local Government, to make sure that these initiatives are also embedded first in the district plans, really assimilated as part of their own working processes, and then also mainstreamed in their daily activities for monitoring, for reporting, and then also for correcting some of these observed indications. But generally, we realize that the area of jobs, a lot of them are documented in the medium-term review. And if you see almost all these areas, there are more additions than even subtractions at all, many of them. And particularly what is exciting is that it is the youth who also benefited, which indicates that if we are able to nurture the right skills and also nurture the right ability among these young people, we should be able to really make bigger gains from these interventions.
The Deputy UNICEF representative in Ghana, Makasi, called for a more collaborative effort between UNICEF and government to achieve sustainable goals in the implementation of these policy framework.
UNICEF supports the government in many ways, but one of the things that we are very interested to support government with at the moment is the development of the medium-term development policy frameworks. And this represents when the government decides to invest in that kind of research and development of different socio-economic policies, we want to make sure that the best interests of children are upfront and prominent within those new policies. And so to be able to help with the evaluation of the last policy framework helps us to inform the next, and the next will run for the next 4 years from 22 to 25. I think this is a very good time for us to help government really be able to build a comprehensive set of policies for the future.
The University Teachers Association has agreed to suspend its strike following an emergency meeting with the National Labour Commission and the Ministry of Employment and Labour Relations. This is contained in a memorandum of agreement between government and UTAG. In conjunction with the National Labour Commission, the Ministry of Employment and Labour Relations also agreed to discontinue all legal processes against the striking lecturers. National Labour Commission secured the injunction against the strike, arguing that the law forbids UTAG from proceeding on the industrial action when negotiations are underway. UTAG is demanding the implementation of a 2012 single spine package, which put entry-level lecturers on a salary of $2,084. Well, today, some aggrieved public sector workers who hit the streets of Accra to protest against a 4% salary increment recently negotiated by their union leaders are asking the Chief Labour Officer to immediately halt the payment. They have vowed to resist any salary increment below 10% and are demanding that government implements the Professor Ntiamwa report. The report recommends that salary adjustment of public sector workers must commensurate with those of Article 71 office holders. We'll share shortly from the leaders of the group, but some of the aggrieved workers who participated in today's protest held placards with inscriptions saying no to 4% virus. Labour union leaders are disappointments and sellouts, amongst others, and they say the introduction of the new taxes pose a threat to their survival. Some of them have been speaking to JoyNews.
Yes, as a public house worker, I'm not satisfied with the 4% increment. The 4% increment, I'm not happy with it. That is why I'm also participating in the demonstration.
I see, but what makes you think that this demonstration will yield the result?
Yes, we are in a democratic country, okay? And then I'm just positive that the president will listen to us and then listen to our plea as we are sending the petition. We are hopeful that he should listen and then address our concerns.
But which specific sector do you work with?
I'm in the health sector.
You're in the health sector, and you didn't go to work today. I'm sure your patients are work.
No, I'm for afternoon. We run shift.
Yeah, you have to afternoon.
Afternoon shift, yes. And then I can't sit down unconcerned and go to work hungry or unhappy. You get it? When you go to work and you are not happy, who suffers? Isn't it the patient? You understand? So if we all sit down and look, trust me, people are not happy. Okay? But because we are in the public sector, people decide to sit back and complain. Now at the end of the day, who suffers? Isn't it the patient? You get it? So if some few of us sacrifice our time to submit this petition, it's also an appeal that our nursing leaders should also listen to us and know that the 4% from 10% reduced to 4%. He said, no.
So what do you want?
If you can increase it to 20%, 25%, we don't mind. Because the ministers are taking 17 and 25. They should give us the balance.
So anything below 10, you reject it?
Whatever our leaders are going to negotiate for us, it shouldn't be below 10. You understand? We are not in normal times.
Right.
With this era of COVID, last year, we had this tax exemption and everybody was excited about it. You understand? But are we saying COVID is over? No, there's no tax exemption. Okay? We are taking our regular salary and you reduce it further. How? Meanwhile, we are also exposed to the COVID. So if we get the COVID and we are not able to get money to manage ourselves, what do? You get it? Right. So we are out today to appeal, to submit our petition. I'm hoping that our President, His Excellency Nana Addo Dankwa Akufo, will listen to us, call our leaders back to the negotiation table, and then review it again. Even if he gives us 12%, it's more than the 10%. At the time, 4% is insignificant to us.
Thank you. Tell us the motivation for this demonstration, sir.
I am motivated to participate in this demonstration because this demonstration is about my life. This demonstration is about livelihood and the source of my income. And for that matter, it is life itself for me. I am saying that this nonsense of 4% must stop today. It has ended and doesn't make sense. They should go and tell this to the Marines. That is why I am here. Look, most of the appointees of the president, many, if not to say most, let me use the old carriers. Some take home 2 billion, 2.5, 1.5 billion OCs. Go to Aviation, go to those big companies, and you see how much government appointees take. And we, those who oil the wheel of government, the public sector workers, some take home pittances as little as 400, 600, 800 Ghana, 1,000, 1.2 million, whatever. Meanwhile, we pay school fees. We buy fuel. Those who don't have vehicles, they bought trucks and taxis every day. Those of us who do not live in our own homes, okay, we pay rent. We buy electricity. We buy water. Most of these big men don't buy water. They don't buy electricity. They don't buy fuel. In fact, our 2% that TUC leadership deducts every month is what they use to drive V8s. That is what they use to live in mansions. That is what they pay themselves as fat salaries. And yet, they have the guts to go and bring home 4%. I see it as a Kokwanansi story. They intentionally sat quietly with government appointees, with the political elites to give us 4%. Meanwhile, the political elites today are paying themselves 70+%.
But we are told that the 4% was an agreement. Government would have to recruit or employ over 1 million Ghanaians into the public sector. With an increase of that, it will be a problem.
Government can decide not to recruit and see if public sector will survive. Because of that, you are giving the people who are the oil of the wheel of governance a pittance of 4%, and you are taking home 70+%.
So what do you expect?
Upon you, your fat salaries, once it takes away your fuel, it takes away petrol, it takes away water, it takes away electricity. We buy all of this. Look at the cost of inflation. Look at inflation rate today. Look at how the cost of living has gone up. Look at the way standard of living has been so low. Look, a lot of public sector men are suffering broken homes. You know why? They are unable to run their home efficiently because there's no money. The money that we take home does not make us survive. And those who are living fat, whose bellies are bought, who live good, who travel anywhere, whose children are schooling abroad, want 70% plus. If they knew that 70% plus was good for the political elites, why didn't they do the same for those of us who buy electricity?
Now, leader of the group, Norbert Gbagbochi, observed that similar protests will be held at the remaining 15 regional capitals should government fail to address their concerns. He asked leadership of the labor unions to return to the negotiation table to correct the wrongs committed against the workers. Mr. Gbagbochi also expressed disappointment in failure by some MPs to assist the group present its petition to Parliament. He's been speaking to my colleague, Kwesi Parker-Wilson.
We've been able to contact one of the parliamentarians, and he has received the document on behalf of the rest. And we have also planned that we would table a petition each to Speaker, Majority Leader.
You said the Speaker says he does not receive petitions. And
Yeah.
receive your petition.
Yeah, even
So
that
why do you
means
still want
that
to petition him?
even when he receives it, he cannot work with it. That is what he means. But what we are saying is, yes, we are going through the right procedure. That does not also stop us from giving him a petition. We think he's, how do we call it, a native of the land that needed to know what actually is happening. So if parliamentary procedures prevent him from receiving an official document from us, we are giving it to him unofficially. We want him to study it and know the situation on the ground. It is not always right or true that you have to use procedure. Sometimes you forgo procedure, look at the intensity of the issue, and you resolve it. That is why we think that, whether officially or unofficially, he must be petitioned.
But you said that you had contacted 10 members of parliament. Who are these members you contacted?
I wouldn't get the names offhand for you, but we
just
did
a
a
few
lot.
that comes to that.
We did a lot. We did a lot.
And their response.
Honorable Kujetwa Blakwa, and some few others.
Were they in the minority or in the majority?
Oh, both majority and minority, because we are not, how do we call it, a politically affiliated group. So we were thinking, that's why we were even targeting Speaker. We thought that neutrality could set in trying to help table our issues for them to have them redressed. But they are telling us that we should still come through the main door, of which we have done today, and we are happy.
But how do you feel that the members who represent you in the parliament or in chamber refused to accept your petition?
That,
1 out of 10.
Yeah, it's worrisome, but it's so because obviously the issues we are mentioning, they have about 90% in there. We are talking about Article 71 office holders. And when you mention that name, the first name is parliamentarians. So if you are petitioning against the vast difference between them and the public sector worker, you will know the natural feeling. I hope you understand. So if they say no, I don't begrudge them, but it doesn't also prevent us from doing what we are supposed to do.
But you are disappointed that, this happened?
Somehow, but we managed to present the petition.
So who is this MP who received the petition?
Honorable Bachman, Bachman received it on behalf of his boss, the Honorable. It seems the name has escaped.
Which constituency does he represent?
Esujaman also. Esujaman, yes, sir.
See, and what do you expect from him?
We expect that he will table the issue through the right channel. That is the standing orders. He will use the correct standing orders of the House to table and raise the issue before the floor of Parliament for the issues to be attended to as early as possible.
You have staged a street protest. You have talked about your concerns. How soon do you expect government to address them?
We have already contacted them through notifications, letters upon letters. And we are thinking that they could have even started resolving the issue before today's petition. So we are giving a time.
Let's now get an update on the bird flu situation in the country, and we'll take a break. When we return, we'll bring you all those details. Welcome back to The Pulse. Remember, you need to join the conversation and tweet at us at the hashtag The Pulse. My personal handle is at the Nana Aisha. We're also live on all our social media handles. Do make a date and be with us. But let's get an update on the bird flu situation in the country, because we know that the outbreak is in 4 regions in the country. Let's talk about the regional breakdown. The number of affected birds and farms. Now, joining me on Zoom for a brief conversation is a risk communicator for the Veterinary Service Directorate, Dr. Benjamin Kisisesu. Doc, I'm grateful for your time this afternoon. What's our current situation with regards to the bird flu?
Okay, thank you very much, and greetings to your listeners and viewers. Currently in Ghana, we still have 4 regions. That is Greater Accra, Central Region, Volta Region, and Ashanti Region. From the 8th of August, that we gave an update to 7 new cases. With Greater Accra having 5 new cases, Central Region 1 new case, Volta Region none, and Ashanti Region 1 new case. So currently in Ghana, we have Greater Accra having 26 cases. We have Central Region 4 cases, Volta Region 2 cases, Ashanti Region 4 cases. Ashanti Region just joined and has moved from 1 within 2 weeks. And just last week, added 2 new cases, and this week 1. Accra increasing by week. But we are able to meet the stakeholders and hope that things will go down. And currently, too, we also have 12,220 beds being affected with the 7 new cases that came in. So currently, that is the update going on. There's one thing that we also found with this investigation. We realized that farmers were not doing well in terms of burial. Before we get to the farm, if the farmer reported maybe on the 2nd day or 3rd day of mortality, when he asked where they buried it, we realized that was a bad place and it has already gotten other people in the poultry industry affected. One issue whereby a farmer went to his colleague complaining that veterinary service came to destroy birds, but I didn't believe that he had bird flu. Then just 3 weeks later, the other farmer also had this case. So last week, the veterinary directorate met the Greater Accra Poultry Farmers Association, had discussion with them because there were ongoing information that don't be compensated, so they should not report. And we have to explain to them and ensure that we are going to do more awareness. And we'd like to say a big thank you to the media for helping us this year in terms of awareness and giving updates to the public about bird flu. And currently we have a lot of short recorded in different local languages for people to listen, which have been sent to the various regions. So from this week up to the end of this month, we'll hear more about what we need to do so as a country we'll be able to contain the situation.
Dr. Benjamin Kisi is with the Veterinary Service Directorate with the Agric Ministry. I'm grateful for the latest information given to us. Now, the world has watched in horror this week as 20 years of hopes and promises for Afghanistan were snuffed out almost overnight as the Taliban retook control of the country upon the hasty withdrawal of US-led forces. Western nations are being called to account for letting it happen. For more on Germany's role, we turn to William Gluckraft, correspondent with our partner DW in Berlin. William, what have top officials there, including Chancellor Angela Merkel, said about the situation in Afghanistan?
It's really been a week of shock here, as in many countries. Well, we've heard from the foreign minister, Heiko Maas, in advance of Angela Merkel. They're both basically sticking to the same line. They're shocked. They called the situation very bitter. Developments happening there, really terrible was Angela Merkel's word for it. And that they are basically sticking to the line that they, along with their NATO partners, seriously underestimated the situation there and the Taliban's strength and their ability to sweep through the country and take back power as they have, as we've seen this week. So there's a lot of soul searching among European and NATO countries today and this week. Angela Merkel and other European leaders are said to be extremely angry and frustrated with the Biden administration, especially as they've worked so hard these last several months, all this year, in fact, to rebuild transatlantic ties that took such a hit during the Trump administration. Joe Biden and many of his high-level staff have been in Europe and especially in Germany the last many months. They've said that they've been working closely together. They've been holding a lot of internal, behind closed doors discussions, especially about Afghanistan, so they could be in lockstep together for a plan for Afghanistan, and all of that seems for naught. And that is what German and European officials are grappling with this week.
Now, how is Germany responding to the crisis, William?
Well, basically, they're responding as they should have been responding the last several months. The German government has been dragging its feet, much to the chagrin of refugee and other kinds of aid groups, to get at least Germany's many local personnel out, translators, cooks, these kinds of people who have helped the German military, helped German agencies and NGOs all of these years, whose lives are now at risk. And Germany, like many European countries and the United States, have been very slow to get these people out, and now they're scrambling to do that. There have been some German Air Force flights into Kabul to get the first few hundred people out of the country, both German diplomatic personnel, German citizens, and local Afghan personnel. But there are tens of thousands, or at least several thousand more people left to go. And Angela Merkel and others have been very honest about the prospects of really being successful in getting everyone out. There seems to be a reality here that many of those people will not be able to get out.
Well, what was Germany's role in Afghanistan exactly?
This was a major commitment of Germany. It was Germany's largest and longest combat role and foreign presence since the Second World War. It had one of the largest troop commitments to the NATO mission there. Several thousand troops at one point at the peak were there. Germany spent as much as 20 billion euros on its commitment there, both in combat missions and in training missions. It's lost 59 German soldiers as well as many more wounded. So this was a big commitment for Germany, and it was a major political statement given Germany's reluctance to engage militarily around the world, given its brutal Nazi past, its past of invading other countries. It's always taken a more pacifist route in its modern history. So this was a major turning event for Germany, that it wanted to show that it could be part of a productive, constructive commitment to global security. So this is really hitting hard back in German political circles back here in Berlin.
William Glowcroft is with DW, our partners. Meanwhile, former Electoral Commission Chairperson Charlotte Osei has observed that the needs of an average Afghan are the same as that of any average Ghanaian. Afghanistan, for over 2 decades, has been a war-torn country, but the astonishingly quick collapse of President Ashraf Ghani's government, with the Taliban taking over the presidential palace on Sunday night, has triggered fear and panic in the capital. Speaking about her experience when she was appointed by the United Nations to head elections in Afghanistan in 2019, Mrs. Osei noted citizens of the two countries desire similar basic needs such as peace, access to education, and healthcare.
It mattered because there was a war going on, and the Taliban were fighting the government and fighting the international community that was in Afghanistan to support the government. And the Taliban are part of the largest ethnic group, and they were spreading, and they were getting more powerful. So it mattered because they could intimidate, they could create situations of insecurity. And so you don't put people out to go and vote when you know that going to vote may result in loss of life or harm. So that was important. But in all this, we can't forget that it's really all about the people, whether it's political parties, whether it is whatever. The actions are supposed to better the lives of the people. And so you don't want to take decisions that put the people in a place of harm.
How does it feel knowing that post-election Taliban is taking over the country, elected president fled out of Afghanistan?
On a certain level, it's very surreal. It's very surreal. I was speaking to one of my friends who is still there yesterday, and I was asking, he's still on the UN compound, and he said, oh, we're being guarded internally. We always had the Gurkhas guarding us internally. He said, we're being guarded internally and externally by the Taliban. And it was very funny.
The Taliban are guarding?
Yes, it was funny on a certain level because all the training they give you is to protect you from the Taliban.
Former chairperson of the Electoral Commission, Charlotte Osei, there. Up next is sports. Stay tuned in.
All right.
right, so I'm here at DSTV, MultiChoice Ghana, where we've just finished the news conference for this big fight night put together by Box Office Promotion in collaboration with some agencies, including GIPC, the Ministry of Tourism and Culture, and also the Ministry of Youth and Sports. For the very first time, a WBO youth title is coming to Ghana, and it will be fought for the very first time in history right here in Ghana on September 4 at the Bukom Boxing Arena. So I'll be having a conversation with all the main stakeholders in this very big fight night, which will be rolled out and will be live on DSTV. I've just caught up with the Managing Director of MultiChoice Ghana. How are you doing, sir? Good to see you.
Good to see you.
Which weight division would you have wanted to fight in if you were a boxer?
I think heavyweight.
Good to see you. Good to see you. Now, tell me about this venture and, you know, what excites you about this particular fight night, which has a WBC and a WBO youth title at stake.
No, I think what excites me is the fact that we are able to support, to grow the sport and get more champions coming from Ghana. That excites me a lot. I mean, I used to watch a lot of boxing when I was much younger. So now we need to support and make sure we get more champions from Ghana.
Yeah. What do you make of the boxer's body language as he gets ready for this fight, him together with his team, and all of what he said so far today?
Sure, I heard him speaking, and I believe him. He's going to knock out the guy. Yeah. And I've also stayed a bit in Kenya, Tanzania. Yeah, they are good, but not as good as us, right? So I support this guy. He's going to knock out.
Okay, thank you very much. And you're still live there on the JoyNews channel. I just had a conversation with Mr. Alex Autry, who's the Managing Director of MultiChoice Ghana. So some more conversations here as we look ahead to the very big one. The President of the Ghana Boxing Authority, Mr. Ibrahim Kote Nikoi. Thank you very much for your time.
Thank you, my brother.
I think that you would have been good for maybe like a bridgerweight or...
I should be the heavyweight.
Heavyweight.
Yeah.
How have you been? How's work going so far since you took office?
Oh, good.
Great. Tell me, promotions have always been at the forefront of pushing our boxing development, especially at the professional level. Tell me how crucial this particular fight night is to that agenda.
Yes, you can see if we have a youthweight title first that is going to fight in Ghana, it's a credit. I remember when the WBO Global also launched, it was Ghana that they fought the first one, that is Emmanuel Tego. And we are always lucky because we have Mr. Samuel Captain, who has been working hard for us. For me as a president, I'm happy. I told you I just took office and I already have a WBO African title. And I'm sure with Lamte that I'm going to keep these two titles to my credit too. So I'm just an happy man. Yes, I'm a happy man.
Now, tell me what convinces you so much about Lamte and his craft.
Well, Lamte, I know his team. I've been visiting them. This is a disciplined boxer. He's one of the guys that GBA is paying attention to. So we are 100% sure that he's taking the two titles for Ghana boxing.
All right, thank you very much, and I'm sure that we're going to expect some more promotions under your administration. So we're still here having a conversation around the very big GH Fight Night series, which is put together by Box Office Promotions together with all of its collaborators. So I've managed to catch up with the WBO Supervisor for Africa, who previously was a president of the Ghana Boxing Authority, Mr. Samuel Captain. Thank you very much, sir, for your time.
Thank you, Ni.
It's good to see you. Now, you've been pushing very hard for a lot of promotional activity. In fact, you previously also served as the lead for promotions in previous administrations of the Ghana Boxing Authority. Now, for you, what is the most crucial thing in rolling out this fight night on September 4?
Yeah, it is a big venture for Ghana as a whole. And this youth world title, which is going to be fought in Ghana. And I wish Lamte to win the title. And I believe I haven't seen him much. I haven't seen his fight, so I can't tell much about him, but I wish him to win this title, that would take him to the world, you know, and also probably the world champion might voluntarily give him the chance to fight for the world title. So let's hope and keep our fingers crossed.
You have been very big on compliance, you know, compliance, and keeping the discipline and the standards so that, you know, internationally we're recognized properly with what we put out there. You've been speaking about a lot of that today.
Yes, you know, our people lack discipline. Some of them lack discipline, and this is my worry. If you want to get to the top, be a world champion, you have to discipline yourself. As I've always been saying about Azuma Nelson, Kote, DK Poison, they all comport themselves and got to the place where they want to get to, and they have carved the name for themselves. So now I believe the youth, the ones coming now, it's not their fault, it's the managers. They should control them. They should control their boxers. They shouldn't allow them to dictate to them. You know, if you are managing a boxer, you are managing his everything, and you are using your resources, so they have to obey you. Otherwise, they won't get there. We have had few cases recently. You know, I don't want to mention the name, and which doesn't augur well for promotion in Ghana or the boxers as so. And we need to discipline them. And I believe the president will take it upon himself to check that the boxers are disciplined, the trainers are disciplined, managers are disciplined. They can't have their own way. To get to the top, you have to go through, I put it, rituals. You know, you can't just get it easy. So I appeal to the president to see to it that it's done.
Thank you very much, and we're looking forward to seeing you on the night. Thank you very much. Mr. Samir Kaptan is president for WBO Africa.
And that's where we part company on The Pulse. My name is Ibrahim. I've enjoyed my almost 2 hours stay with you. Let's Talk Showbiz is up next. Do enjoy the rest of our programs.
It's midweekend. You're welcome to Let's Talk Showbiz here on the JoyNews channel. My name is Doreen Avio, and today we get to talk about Mr. Drew and Kwame Eugene. I'm sure we've all followed the feud or the back and forth between the two, but it looks like things are really gradually getting well between the two of them. We'll hear from the CEO of Highly Spiritual, that's Kewa, and of course, Kiddy from Links Entertainment. Plus, Asamoah is also in the news. He's working on a book. I'll give you details on that. And also, rapper Lil Wayne. I'm not talking about the Ghanaian Lil Wayne. I'm talking about the US Lil Wayne. He also has a revelation. We'll bring all of that here on the show for you. My name is Doreen Avi, and the show is Let's Talk Showbiz. Now, if you're just joining me, this is Let's Talk Showbiz, and we're starting with the CEO of Highly Spiritual, that's Kewa. Now, if you realize, or if you've noticed or followed closely, then you realize that there was an issue between Mr. Drew and Kwame Eugene, and that was because there were reports that they were artists who steal people's songs. But it looks like Mr. Drew's comments didn't go down well with Kwame Eugene. He later gave a reply, and you know, it was all not really good until we saw Kwame Eugene perform at Mr. Drew's birthday party, making it look like everything was okay. Now, let me tell you something. Kewa, who happens to be the CEO and also manager of Mr. Drew, says that, listen, the two have sorted out their differences. They are cool. Everything is fine, and that it happens. But hey, they are brothers now, and that we should go all out to support them wherever they are and whatever they do.
Well, I've heard worse stuff. I mean, as a producer, I've been producing for next year with 24 years producing music, and I've heard a lot of things about me, you know. So once he's attached to me, when I heard these things, when I heard them for the very first time, I said, listen, these things will come and pass. Keep pushing, keep working. Listen, most top artists in Ghana will sample a beat one way or the other from maybe foreign artists, and it was not something, we came to meet that, okay, but I believe that the Ghanaian music or music in general is now we are now taking it a bit serious. That's why all these things began to come up. Because for me, in those days, it was a very usual thing to do. You know, but the music policies and the laws in music are now working properly. So that's why perhaps you can say in this era we're having these things. But you know, they don't destroy the artist, they only make him stronger, and they only give him an opportunity to always go up. He's one guy who never believed in anything bringing him down. Anytime he went through these things, he knew that it was an opportunity for his next level. And he's proven that. He's shown that he's not one artist who wants to give up, but he pushes and gets himself there. You understand? Yes.
And before I let you go, how do you feel about his whole back and forth with Kwame Eugene? I mean, that thing, sometimes we wonder, why is it like that? Because they are both labeled as something we all don't know why it is like that. How do you feel about their whole back and forth?
Well, I think that they are great friends. And when I had the back and forth with Kwame Eugene and him, I think that is, I mean, it's happened for even producers before, and it helps the artist. I saw maturity when Kwame Eugene mounted the stage and performed with him. So it should tell you that it really isn't a big deal. You know, it's something to support both artists. I mean, you go through that, and let's understand that when you go through these things, it doesn't mean that it's the end. The Ghanaian music agenda has to be pushed, and so I believe that both of them are putting that effort in. So they're great artists. Kwame Eugene, if you ask him about me, he would tell you that before he began, I told him that by the time he's produced about his 6th song, he'll be all over. Ghana hitmaker, he'll tell you some of the things I told him that has come to pass. So I believe in that artist a lot. I believe in his craft, and Kwame Eugene will go far, trust me. And because I know it, give him a little time, he will top a lot of things. And so I believe that these are artists we shouldn't separate, put them together, and then push them.
Now, to also confirm the news that Kwame Eugene and Mr. Ju are okay, of course, Links Entertainment signee, who happens to be Kiddy, who also has a song with Mr. Ju, says that if things were not too cool between the two of them, he wouldn't be working with Mr. Ju. It's just to confirm it. Let's hear from Kiddy as well. And Mr. Ju at each other's throat most of the time. How does that feel?
They are fine now.
They are fine now.
They are good. So that's why, I mean, I can be here, otherwise it'd be betrayal, you get me? But yeah, I mean, I want everybody to support each other, fighting and here. Let's stop fighting, let's stop the bickering and throwing shots at each other. The industry is so small, we need to get somewhere together. Let's enjoy, as I said. So I'm happy that they've mended their, broken wings, and we're here to support my brother, Mr. Ju, yeah.
Right, so that was Kiddy right there. So now when you go out there, whatever you do, just have it in mind that Mr. Ju and Kwame Eugene are on good terms, and maybe, who knows, maybe a song could come between the two of them, maybe a collaboration or something of the sort. I know we all can't wait for that. Now let's move straight to footballer Asamoah Gyan, who has been talking about, releasing a book here and there. Well, my colleague Becky caught up with him. He's been talking about the book and when he plans to actually release it.
Yeah, we're working hard on the ground. We created the press lounge to create awareness for people to know Asamoah Gyan is coming to launch a book. So we're looking at somewhere in October, to make sure everybody is comfortable and then participating on the book launch, because it's going to be a very, very huge event. So
how huge would that be? Because I'm anticipating.
Yeah, definitely. Everybody is invited. It's going to be the book launch. Everybody is going to know.
Right, so that was Asamoah Gyan. So we are all looking forward to the book. I bet he has so much to pour into that book, and we are also going to wait to read and also learn one or two things from him. And now to some international stories. As I said, Lil Wayne, and when I say Lil Wayne, I'm talking about the US one, not the Ghana one. So he's actually revealed in an interview that at age 12, he almost committed suicide. Listen, the young man was just telling his story of how it all happened. In fact, I was shocked hearing him at age 12. Did you ever think like that? I don't know, but hey. Right, so that was rapper Lil Wayne on his story, and I bet he has so much to share with the world I haven't really seen him much lately in terms of music or what he does, but I guess it's good to sometimes share stories like this to motivate others. Of course, he didn't kill himself, and we've really enjoyed good songs from him. This is where we wrap it all up on Let's Talk Showbiz today's edition. My name is Doreen Avia. A very big thank you to you, Ike, and of course, Sami on production. We are back here same time on the Joy News channel. Until then, have a great evening.